mga ka-lunch chat! I'm April.
And I'm Zyrah, and we are from the USTP Career Center.
Hello, and maayong pagpaniuto to our fellow trailblazers tuning in at Cagayan de Oro Campus, Alubihid, Oroqueta, and Panaon.
Of course, dili na to kalimtan ng ato ang mga trailblazers from Claveria, Balubal, Hasaan, and Villanueva.
Yes, I know it's been a long time since we had our lunch chat segment, and finally, we have found the time to talk again with our fellow trailblazers.
You're right, Miss April. No, this is also a great opportunity for us to know ang ato ang mga accomplishments and most importantly, ang atong progress there is a university.
Yes, Zai, but before anything else, let's take a look at our food feature for today. There we have it. So for more information about our food feature for today, please visit the USTP Northern Mindanao Food Innovation Center. So, Zai, ready na ba ka this noontime, this lunch? Kapag paniuto na ba ka?
Wala palagi, Miss April, no? Pero I believe, mabusog yun tano. Of course, ang ato ang mga viewers for today's episode.
Yes.
Because ang atong guest for today is a prominent person in advancing our technologies here in the university. So everyone, please help me welcome Engineer Alex L. Maureal, the Vice Chancellor for Research and Innovation of Cagayan de Oro Campus, and of course, the project leader of the Healthcare Information Management System, or the HIMS.
Ayan, good noon, Sir Alex. Pleasure to have you here po.
Maingod to sa tanan o sa atong mga viewers.
Alright, so sir, to jumpstart the conversation. So, as we know, the university has been using HIMS for quite some time. I believe it was implemented during the pandemic, kasagsagan sa pandemic, and from students, faculties, and even our staffs, it's really, it's widely used and it has a lot of benefits. So, can you share to us, sir, what were the reasons on the conceptualization and also the implementation of this project?
You know, April, before the pandemic, we have issues and problems with our health care services to our students. Now, one time, I was called by our then president now, Sir Boots Cultura, who was the Vice Chancellor for Research and Innovation during that time. Why is it that there are a lot of students queuing at the medical center? And the reason was they're asking for a medical clearance certificate because there is an activity for the students. So I asked one of the students, why is it there is a queuing in the area? So after learning that we have problems in medical records retrieval, also there are also problems in the number of physicians available in the clinic. So even before pandemic, we have issues already, problems in delivering our medical services to our students. And after the pandemic, that was March 16 of 2020, a few months after the pandemic, so I was able to conceptualize how we can improve our services. And then, especially during pandemic, na wala ang mga estudyante din. So they're paying for medical services fee. But unsaon nila pagkadawat sa serbisyo? They are not in the university because during that time it was lockdown, a lot of lockdowns. So I conceptualized the idea of how we can bring the services, the medical dental services to the students, even if they are still in their area, in their homes. So that's how healthcare information management system was conceptualized. So I talked with our medical director during the time and the nurses on how we can improve, and then was able to present the idea, and it was approved. That was June 25, 2020. Initial funding of 4.8 million to to do the project.
So looking back, sir, no, dili magyud di ay basta-basta ang journey sa HIMS. So with the goals and the idea of the HIMS, is there a possibility na ang HIMS can also be accessible outside the university, of course, to promote linkages and internationalization perhaps?
Yes, of course. In fact, I was able to present this idea of giving healthcare information, giving healthcare services to not only to our students, but also to our employees as well. So during the program of the TPCO, that is the Technology Promotions and Commercialization Office, they're helping us to promote our technology created, in particular this healthcare information management system. We received a lot of comments, good comments, on how other universities can also have this kind of services, just like ours in HIMS. And then, of course, this is accessible via internet. And right now we are developing the mobile apps for our students for convenience purposes, and of course increasing the services not only for medical. We started from medical, then afterwards dental services. Then of course we learned a lot that there are a lot of students are having problems, psychological problems. So that is why we extended our help. We hired four medical doctors and one psychologist, and of course we also added in the team the HIMS nurses, and they came from reputable hospitals and in giving the services. So we're open to that. No, we're open to that. In fact, we want to share this technology to others. It's quite disturbing na when I talk to them, wala di sila services for medical, psychological guidance during the pandemic time. Even big universities wala. But starting with the conceptualization of the project, we started doing the project by July of 2020. The good thing is that we want to make our healthcare professionals be part of the project, the ownership, no? So part sila sa ato ang design when we conceptualize. Pag-start pa lang nato, nanatada yung serbisyo na hatag. So we started with I cannot imagine, no? For how many years ang school nag-exist, we only have around 7,000 records for the past. Yes, only 7,000 records. That means that just probably they have some not good experience in visiting our medical center, our medical health clinic. So that's one area that we want to improve. We're able to do that, and we extended our help not only for students and employees in CDO campus, even Claveria and Panaon, Kita, and we receive a lot of good comments from our students and our employees. So we want to share this one, and in fact we had an ongoing talk, an arrangement, a possible technology adapter company that wants to promote this teleconsultation technology to other universities in the country. We'll start siguro from Northern Mindanao, and in fact we are now preparing for that plan. We want to share, we want to collaborate with our international partners.
That's very interesting to know, sir. No? And can you share to us, I believe this the HIMS was recognized na you went to Thailand to receive an award. Can you share to us that experience po?
Yeah. This project was nominated in the BET Asia Awards.
Wow.
BET Asia Awards, and in the well-being category. Because we, of course, the real purpose of this project is to take care the well-being of our students as well as our employees. So we are able to submit with the help of the Office of the President, with the Stratcom, our international linkages. So we're able to submit, and we're happy we're nominated for the BET Asia Awards. We went there, and we also observed other. We also have other. There are also countries that submitted for that category, and we also learned a lot from them, and they also learned a lot from us. Na even we are located in Mindanao, Even our students are of course, coming from different areas. They were able to receive the services that they wanted. Not only we provided this type of services, right now we want to improve in our guidance services. So soon we will be hiring guidance counselors, and they will be providing services online, and this caters to all the campuses na may kulang sa guidance services. Because during the time na-implement nato ni, over around 13,000 nga consultations were done. Just try to imagine, for the past how many years before the HIMS project, we only have 7,000 records, but just 1 year and a half of operations, we already have consultations around 13,000. We even reached up to around 12,000 students and employees in the system, not only in Cagayan de Oro City campus. So we're able to provide the services, including na ang atuang guidance counseling. I asked our nurses, can we set a time wherein we can have, I call this idea of active surveillance. So the plan for a week that they will call a particular students in random, and then they will talk to students. So they reported to me that out of 10 calls that they were made, 3 of which 3 students asked if they can talk more. It's more than an hour that they talk, meaning they really need psychological attention. So that's why we referred it to our guidance counseling, and we referred it to our doctor. We only have one psychologist, and that is why na-overwhelmed atong doctor yung pa niya. I was hired for the employees, but this is for the students. But anyway, I'm happy that I can help them. So kana siya, nalipay ko sa epekto, and that's why we are now planning how to improve. Kailangan pa siyang improve. Then after improving it, redesign it and upscale it so that other universities can also utilize the technology.
Wow, that's very, very inspiring. And the fact that you were nominated for the well-being category po, it really says a lot about the system, and especially, I like what Sir said about holistic na ang service, because it started out as a parang medical lang to help solve the problem, katong taas ang queuing, you mentioned earlier, sir, and then gabot ang pandemic, but now it's going to expand pa nga holistic na, especially psychological, mental health, yun, sir, is really big. It needs attention. It's good that HIMS is like going towards that direction, yun, sir, no? What is your 5-year vision for HIMS as a digital platform in the university?
Well, we're already operating for the past 2 years, and we're looking forward by the next year, the 3rd year, we can develop the mobile apps for the clients, for the patients, the students, and the employees. And then in the 4th year, we're looking at that we can implement the new version of it, where we can already include the scalability of the system. The idea is make it in cloud service, so that other schools and other clients can also benefit the HIMS services. So we want to share this as a software as a service to other state universities and higher education institutions. So I am looking at, in the 5 years, in the 5th year, I'm looking at that it will gain prominence, and this technology will be adopted by technology provider or other schools. So somehow the idea is helping the students, but in the other hand, adopting this technology means also revenue generation to the university. That's how I look at HIMS in the next 3 years, so maging 5 years.
Wow, exciting kayo ang sir no ang vision nato for HIMS. So thank you kayo so much Sir Alex no. It's limited kay ang time but grabe very fruitful kaayo ni nga discussion and I hope our viewers really appreciate our platform na HIMS po no. And thank you kayo sir for your time. Alright.
Salamat po kayo og sa atong mga viewers.
Alright, so to our trailblazers tuning in, that was, we just talked to Sir Alex and it was a very, very productive and very fruitful discussion about the platform HIMS. So at this point, no, we would like to plug our USTP Career Center activity. So heads up to all of the fourth year graduating student leaders, this one's for you.
So again, no, the Career Center and Industry Relations Office will be holding our Career Networking Night. For more details about our event, kindly please like and follow us at our official Facebook page at USTP Career Center.
Alright, so again, thank you again Sir Alex for joining us here today in this episode.
Yeah, pwede po sunod.
Oh, diba? Alright, so wrapping up, no, in the university's 7-point agenda dynamic, HIMS falls under the letter I, which is to institute effective and efficient finance and administration services through innovative and technology solutions.
So stay tuned mga ka-LunChat, no, because in every episode, we will be tackling about the 7-point agenda, which is the dynamic vision of the university. So see you next episode for another meaningful and fruitful chikahan, no? So once again, this has been Zyrah
And this is April,
your resident dynamic duo.